Hi there, everybody. Welcome to the talk on mitigating air pollution in South Asia and beyond. You'll be hearing from Santosh Harish today. Santosh is a program officer at Open Philanthropy. He leads OP's grant making in South Asian air quality and some other public health risks. He previously worked as a researcher focused on air quality governance in India at the Center for Policy Research and the India Center of Energy Policy Institute at the University of Chicago. He has a PhD in engineering and public policy from Carnegie Mellon University. Without further ado, Santosh Harish.
Thanks, Jay. Hello, everyone. Good afternoon, good morning, good evening, wherever you are. Thanks for joining us on a Sunday. I will be talking about the air pollution crisis in South Asia, and we'll talk through the scale of the problem, some of the sources of air pollution in this region, and what we've been doing as Open Philanthropy in grant making to solve the problem, or at any rate, speeding up the solutions to this problem. So first, let me talk you through the scale of the air pollution crisis and how it impacts human health. So when we talk about the problem of air pollution, especially from the lens of its health impacts, we are primarily talking about a pollutant called fine particle pollution, or PM 2.5. This is particulate matter that is less than 2.5 micron in diameter, hence PM 2.5. These particles are of various chemical compositions. They are basically solid or liquid particles that are suspended in the air. And because they're as fine as they are, 2.5 microns is a tiny fraction of the thickness of your hair. They're able to penetrate deep into the human body. That they enter our body through our lungs, enter the systemic circulation, and are able to reach a variety of different organs, basically being in places where they have no business to be and causing a variety of harms. As you can see from this map, the levels of PM 2.5 are particularly high all across the LMICs, especially in South Asia, India, Pakistan, Bangladesh, Nepal, in China, where air pollution has been receiving a lot of attention for at least a decade, quite a bit more than that, and in many parts of Africa. Air pollution levels were high in much of the industrialized world, in Europe, in the United States, in the UK, where famously there was something called the Great Smog of London, which just over a matter of few days killed something of the order of 10 to 12,000 people. Right. But since then, these countries have made a lot of progress, and air pollution levels have significantly improved, whereas in the LMICs, it remains a significant public health crisis. Now, South Asia is particularly worse off, even compared to a standard of 40 microgram per meter cube, which is 8 times what the WHO deems as safe levels, right? 86% of the population of this region, right, exceed the Indian air quality standards, right? Within India itself, this number is closer to 83%. These numbers vary from year to year and from one source to another, but ballpark, it's of the order of 80% or more. North India is particularly worse off. In fact, if you sort of zoom out and look at the map of this region, you sort of see this continuous red cloud in this image, which basically spans all the way from the Punjab province in Pakistan across North India, with parts of Nepal, the plains in Nepal, and virtually all of Bangladesh is part of it, right? This is a region that has several hundreds of million people, so who are exposed to these elevated levels of pollution. because it sort of spans such a wide region, as we're going to talk about in just a few minutes, interventions to reduce air pollution also need to span sources and span administrative jurisdictions across this area, which becomes a significant governance challenge. How does air pollution stack compared to other sort of known risk factors that affect our health? Right, it is the fourth largest risk factor globally, accounting for something like 6.67 million premature deaths as per the global burden of disease estimates. Right, so you have risks that I don't need to sort of sell you on in terms of tobacco smoking, high blood sugar levels, and so forth. And air pollution is right up there. It's the single largest environmental risk factor that affects our health. But what does that mean? What precisely about our health does air pollution affect? Right. So here we have the sort of again the burden of disease estimates now framed in terms of the disability adjusted life years, basically the number of healthy life years lost per 100,000 people, but focusing on India. Right. So we have two sources. We have air pollution. We have tobacco use sort of head to head against each other. And as you can see, across a range of very different illnesses, right? Lower respiratory infections like pneumonia, chronic obstructive pulmonary diseases, which are basically these chronic lung infections that can't get reversed once you have it. Ischemic heart disease, strokes, diabetes, right? Take any one of them, and you find that the air pollution levels in India have burdens of disease that are sort of on par with tobacco, if not worse, right? And that should sort of give you a sense of how harmful this is for our health. Once again, why does air pollution, I mean, it's presumably plausible why air pollution affects our lungs and our heart, but then why does it affect things like diabetes? It's because particulate matter has several different chemical constituents in it, right? So it's not a single chemical compound. It's a bunch of different things that happen to be 2.5 micron or finer, right? So this includes toxic heavy metals. This involves inorganic compounds like sulfates and nitrates that get emitted due to the burning of fossil fuels in power plants, in vehicles, and so forth, right? So it's a variety of different substances, many of which are extremely harmful, that are able to penetrate into our body, enter various organs, and cause these different types of harms. And the burden of disease is in some ways focused on the very young or the old, right? So when we think about premature deaths or premature mortality, we are primarily talking of this happening among neonates, basically babies that are 27 days or younger, or folks who are older, typically 40, 50 years or more. Now, there are three types of pollutants that are there on this graph, right? So you have ambient PM 2.5 that we've been discussing. There is household air pollution, which is also to a significant extent PM 2.5, except that it's from a particular source. It is primarily from the burning of solid fuels and other more sort of polluting fuels that are used for cooking or heating or lighting, right? Primarily resulting in heightened levels of air pollution indoors, but then eventually this also these pollutants also make their way into the ambient. And there's something called ground level ozone, which is also quite harmful. But as you can see, the PM 2.5 in the ambient or from household sources really sort of dominates the burden of disease estimates. So what are the sources of air pollution, and how are they meant to be governed, and where do sort of gaps in governance come from, right? So if you look at the air pollution in India, right, there are several very different sources. So there's the single largest source of air pollution exposure in the ambient at a national level is basically hundreds of thousands of households that burn biomass for cooking, for space heating during the winters and so forth, right? That's the single largest source. And in many ways, it's sort of a counterintuitive source. You think of air pollution, you're thinking of vehicles, of smokestacks from power plants and so forth. But a very large number of household level sources do add up, right? And then you do have coal combustion in power plants, in industries. That's the sort of the next large source. There is dust from a variety of different activities, from construction, but also from industrial activities, right? That's sort of next up. There is burning of biomass, agricultural residue in farms, waste, sort of municipal solid waste, those being burned in the open adds up. So it's a variety of different sources. So what I'd want you to take away from this particular slide is that air pollution isn't about any single source, right? It's about a variety of different sources that operate at different scales. Some of which are, hundreds of thousands of household level sources, or hundreds or maybe thousands of industries, and a whole bunch of very dispersed activities. So that's one takeaway that I'd encourage. The second is, if you look at it may not be obvious on your screens, but I'd sort of draw your attention towards how each of these bars have a solid part and sort of a hatched region. What this actually sort of means is that the average rural pollution exposure is similar to average urban exposure, right? And as a result, the health impacts on average in rural India is quite similar in scale to urban India, right? Which would basically sort of, it goes, once again, it's counterintuitive. You think of air pollution as a primarily urban crisis, and that's just not the case. That was true, for example, in some of the industrialized cities in North America in the beginning of the 20th century or something. But one of the ways in which air pollution is sort of qualitatively different in South Asia, in many LMICs compared to the industrialized countries, is the sheer variety of sources that actually go beyond the standard urban sources of pollution, right? Which makes governance sort of more challenging. So if you then sort of zoom into a city like Delhi, the capital city of India, which is very often in the news for its air pollution. It similarly has industries and transport and biomass and waste burning, dust, all sort of contributing 20% plus or minus 10, depending on which source, which sort of research study that you prefer. Each of them have sort of different advantages, different methodological sort of assumptions. But the main thing I think to take away from this slide, just the last one, is that there are multiple sources, all of which sort of substantially contribute to air pollution in this city, right? And to be able to make progress, you need to be able to make progress on each of those different sources, right? The average annual average levels of PM 2.5 in Delhi is of the order of 100 to 120 microgram per meter cube. India's national standards are about a third of that at 40, and the WHO guidelines are a 20th of that at 5 microgram, right? So making progress on any one of these sources is simply not sufficient. So that makes this sort of a harder nut to crack. Now, when we look at sort of the governance, right, of these different sources, there are a jumble of abbreviations and names here. But basically what this slide tries to do is map who is responsible at what levels of government, at the federal, state, and local levels, right, for each of these different sources. As you can see, that it's a mesh of agencies, right? and this is one of the main challenges at the moment. To make progress on any one of these sources requires coordination across the federal, state, and local levels, right? It requires coordination across geographies, and that's really quite hard to do in countries that have weaker state capacity in particular, which is the case with India, right? So at its heart, therefore, this becomes a state capacity problem, which is the ability of the governments, at various levels, to be able to plan well, to implement actions that they have, they already have legislated and so forth, well, to be able to sort of provide routine service delivery, right? Well, that becomes that's sort of at the heart of the challenge of air quality governance, right? Now, governance institutions in India across a range of sectors, health, education, what have you, have been sort of studied quite extensively. This is a common common issue that has been diagnosed. There have been different sort of expressions that scholars who work on state capacity have come up with, about how India is a flailing state. It's a state that has strong arms, but clumsy fingers. So it's able to take sort of significant action when it means to, but when it comes to sort of more nuanced work, it's harder. And this third expression is something that I really like, which is that the Indian state is good at episodic delivery with inbuilt exit. When it's about coordinating elections across 1.3 billion people, right? It's actually done really well. But when it comes to sort of routine public service delivery, the way waste gets collected and managed, the way buses run, right? The way roads are maintained and so forth, that becomes the hard bit. And pollution mitigation, almost by definition, from like an econ lens, right, requires state intervention. Air pollution is an externality which requires government intervention. And in this case, of very different kinds. You need sort of more conventional, modern environmental regulation of industries and vehicles. When it comes to managing dust, avoiding waste burning, you need improved routine public service delivery. To reduce household burning of solid fuels, you need the state to provide clean, affordable energy to these households, right? So it's very different types of government intervention, and all of this becomes harder because of almost these heroic levels of coordination across departments, across administrative units, across states, and so forth. Right. So, what have we been doing as part of the South Asian Air Quality Program? The Open Philanthropy's Air Quality Program began in January last year. So it's been almost 2 years in a couple of months. We've made about 25 grants, given away about 18 million. We focus largely on India, although there are a couple of projects in Bangladesh. But across India, we've funded work across more than 10 states in the country. Right. And the types of things that we've funded, our sub-strategies have been quite different. There are some that have sort of focused on improving the functioning of the existing policy framework, right? Where we are basically funding somebody to work very closely with government agencies, in some instances getting embedded into state and local governments to help them improve policy design, improve policy implementation, right? Then there is a bunch of work, in some ways, in the way I've classified it here, the biggest bucket of work, which is to sort of move air quality governance forward, advance reforms. For example, moving away from mitigation efforts that have historically been within cities at the city level, right, and conceptualizing air pollution as primarily an urban problem, to one which recognizes that it's a regional level issue that requires coordination across states, right? So that's that's something that we've funded a few organizations for, including the World Bank, which has been doing some really nice work with Indian states. We have been trying to speed up the use of what are called hybrid monitoring systems, right? So conventionally, how do you know that a particular city, state, neighborhood has high levels of air pollution? There are something called regulatory grade monitors, right? That measure the concentrations of these pollutants in the air. Now these are quite expensive and are sort of procured by and maintained by the environmental regulators, pollution control boards, right? Now, because of their costs, the level of sophistication required for sort of maintaining them and so on, you can't have, thousands and thousands of these, right? Which reduces your ability to monitor air pollution levels, right? So something that we could consider doing, and something that, for example, the City of London has done quite well, is complementing the regulatory grade monitors with sensors that are significantly lower cost, almost 100th of the cost, right? But having hundreds of them, dramatically improving the spatial granularity of measurements. These sensors could also be used for monitoring air quality in remote locations, right? And that's in fact one of the grants that we've made, which is to fund this academic group to set up something like 1,400 sensors across 2 states in northern India, right? Covering every rural administrative block, and therefore, potentially dramatically improving the visibility of rural air pollution, testing this particular use case of sensors, and so forth. Another area of work is in enabling quantitative policy analysis, right? Evaluating which interventions work, determining a priori which interventions may work by sort of modeling the impact of the potential set of interventions out there. Now, this requires building scenarios and modeling what happens when pollutants reduce. This is harder than you'd anticipate. When a particular intervention to reduce air pollution is implemented, it reduces emissions of these pollutants at the source. But then these pollutants, right, react with other substances in the atmosphere. They are extremely sensitive to meteorological conditions and so forth, right? What this then means is for you to be able to estimate that this particular action, this particular new standard that has been set up to reduce the emissions of pollutants from vehicles, for example, right? What impact would that have on the atmosphere would require very, very sophisticated modeling. And something that we've funded is the development of what are called reduced complexity models that attempt to capture this dynamic, but sort of at a more approximate level, but with the advantage that requires significantly less computational resources. It requires significantly less training, right? Or sort of requires significantly less understanding of atmospheric models and so forth. And that we hope should be able to sort of speed up generating this body of quantitative policy analysis, right? And finally, a bunch of work has been primarily to sort of improve our understanding of air pollution. Now, philanthropies are perhaps not always best placed to fund academic work, but there are in many instances places where funding work that sort of provides us critical information that helps define the problem much better, helps identify solutions well, could have sort of outsized impact. And that's basically what we're looking for with the sub-strategy. I wanted to end with some notes on the kinds of stuff that are likely to be more scalable, more tractable in other parts of the world, right? So one candidate that's likely to be particularly easy to replicate are low-cost sensor networks, right? Especially in countries where we believe there are likely high levels of air pollution from satellite data and other estimates, where there are no monitors with data that's available publicly, and in countries which receive basically no philanthropic funding, right? So in these instances, the first few monitors, with publicly available data may have outsized impact in, you know, alerting people that there is a problem, right? In leading to sort of media attention, government attention even, right? These networks could be hosted by academic groups, by advocacy groups, and this is something that we are now exploring, potentially funding in different parts of the world. And then, of course, and in some ways, almost sort of building off the foundation of like reasonable data already being available, advocacy around common solutions, getting the dirtiest vehicles off the road, transitioning away from diesel fuels, transitioning households and other actors away from solid fuels, and at a sort of nationwide scale, transitioning away from coal towards cleaner energy sources for electricity, right? These kinds of things are likely to be generally quite beneficial. That's likely to be good advocacy strategy. I'll pause here, and I'm really looking forward to your questions. Thanks.
Great. Thank you so much for that, Santosh. That was brilliant. If you have any questions, please put them on Swapcard, and I'll put them to Santosh for you. Let's see if there's any there. So we have one question to start with from Rishi. If one believes democracy is prone to populism and polarization, then dysfunction can also be a challenge which a given NGO should expect. Is air pollution a problem which is simply too big to address absent state cooperation?
I do think that state cooperation is pretty critical, right, to be able to address air pollution. One of the things that makes me optimistic, right, is that there are actually multiple entry points that are possible. Now, it's possible that getting a government that is not persuaded that you need to, sort of dramatically decarbonize, reduce the amount of coal that's being used for power plants, getting them to like enact sort of tough regulatory standards against coal power plants and so on might be quite difficult, right? But it's possible that managing solid waste better actually gets a reasonable amount of traction. Improving urban mobility better potentially gets good traction too, right? So given the sheer variety of sources available, it makes me generally quite optimistic about being able to find those points of entry where there is a window of opportunity to work with governments, right? And then over the course of over time, one can sort of become more ambitious and sort of work with other sources that might be a harder sell. But yeah, I do think that a cooperative state is quite crucial.
Thank you. Great. And we have another question. So this is from, sorry if I get your name wrong, Somano. I recently heard about a scheme called PMUY in India, which aims to distribute LPG connections to women below the poverty line. Mm-hmm. What do you think of the importance, tractability, and neglectedness of this intervention?
So the PMUY, or what's sort of popularly called the Ujjwala Yojana, essentially provided subsidized access to clean cooking fuel, to LPG, to something like 100, forgive me, 10 million households, right? I'm converting from crores to millions in my head. I mean, this was, this program had sort of was sort of astonishingly ambitious in scale and was implemented quite well. So just sort of as a starting point, it was an extremely good intervention. The thing, though, is that providing subsidized connections is sort of not sufficient, right? You need to ensure continued usage of these cleaner fuels for cooking, which in the last few years has been a bit of a challenge. The subsidies for these, for example, were removed. The prices became much higher, unaffordable to many households, and therefore, while the Ujjwala Yojana was a good start, I do hope that it sort of followed up with sort of providing greater subsidized cooking fuel, which sort of does come from time to time. It was recently sort of announced again, subsidies for poor households. It is a challenge. One of the difficulties here is that from a fiscal standpoint, right, providing subsidized fuel to tens of millions of households is extremely expensive to the Indian state, especially given that much of this comes from imported petroleum, right? And as a result, this does involve difficult trade-offs. Given the impacts it has on health, I'd submit that the benefits here far outweigh the costs, and therefore I think makes for a very good policy.
Great, thank you. Just expanding upon that, from myself, this question is, how has the government responded to expert advice and these particular economic and financial trade-offs in addressing this issue? Has it been a positive response, or is it quite fraught?
Yeah, so that's actually a difficult question, in the sense that I think the response to different sources, so zooming out, the response to different sources of air pollution and the likely mitigation actions that would be helpful has been quite different. For example, in response to advocacy around tighter emission standards for coal power plants, right? Which similarly, where the benefits would outweigh costs. The Indian government has actually pushed back quite a bit, because there are other considerations of energy security. There is sort of a larger conversation on climate policy and the idea of a just transition away from sort of fossil fuels. So in many ways, the air pollution advocacy got caught up in this sort of larger conversation and went nowhere. With household fuels, I think the Indian government is quite responsive. The trouble is that the fiscal costs are actually quite significant. So the one reason for optimism is that subsidies for cleaner cooking fuel are actually extremely politically attractive. And we have seen that some of the states have actually started introducing these subsidies. That's a new thing. Traditionally, these have been federal or central subsidies, and because of how politically attractive they are, state governments have actually started subsidizing this. So there's an interesting sort of political dynamic that's sort of at play in the last couple of years. In this particular case, I think we might very well see different attempts at trying to make cleaner fuels sort of more affordable.
Great, thank you. We have another question from Rishi. With respect to India in particular, it's been the case that the government's budget balance has been determined by its energy import bill for maybe 50 plus years. Given the country's relatively poor endowment of natural resources in comparison to, say, Brazil, isn't any effort to mitigate air pollution implicitly a question of energy policy?
Not always. With the household fuel, that's definitely the case. But again, sort of taking you back to that sort of diversity of sources that I described earlier. In many instances, there's actually sort of almost no connection between the two. There are a whole bunch of potential policy actions that would basically make the vehicular fleet, for example, cleaner and more efficient, right? Actually, in many ways, reducing this energy import bill. I would count several vehicular policies to actually be pretty favorable from from an energy import standpoint. There are a bunch others on, for example, the way we manage construction dust, right, which has nothing at all to do with energy import, and that's once again a source that really adds up. In recent months, in fact, the city of Mumbai, which is it's a city on the coast, right, and traditionally has been sort of quite clean, but in the recent few years, it's sort of been in the news a lot for its air pollution levels, which largely owe to vehicular emissions and just basically a big construction boom, with very few sort of efforts at managing the dust from these sites. So that, for example, I think has got absolutely nothing to do with energy import.
Great, thank you. Any other questions coming up? No, just one more for me for now then. So you were just mentioning, for instance, in New Delhi, these vehicle emissions, like in many countries, this is a particular big issue, and there's often a lot of public pushback in some ways around these issues. Is that similar in India, or is it mainly kind of a top-down issue?
No, it definitely is an important issue. Most efforts at trying to get older, dirtier vehicles off the road get sort of some degree of pushback. Efforts at taxing, right, for congestion, or efforts at sort of increasing parking charges as a way to sort of curb the number of vehicles that are plying on the road get a lot of resistance. There have been a bunch of initiatives on trying to improve public transport infrastructure. For example, making some lanes on major roads exclusive to buses alone, which gets a lot of pushback from the folks who drive cars, saying, "Well, we have lesser space." So I think that definitely has been a sort of there has been significant pushback from vehicle owners on many of these actions. It's definitely part of the politics of air quality mitigation.
Great, thank you. And we have another question. Can the problem be framed in terms of human rights, e.g. against the backdrop of not only being SDG goals, but also a more fundamental entitlement?
It can, and there have been efforts from advocacy groups to sort of frame this as a right to life type argument, or a right to sort of good health. If you were to ask my personal opinion, I've never been able to sort of figure out what happens next, right? How that sort of fundamentally sort of shifts the government's attention towards some of these mitigation actions, right? Because let's face it, right? With India, with many other LMICs, air pollution is one of several almost competing public health crises, and I think it's quite hard to sort of try and treat some of these as sort of special cases, because they tend to be very large intersections with other issues, other governance challenges. So in some ways, efforts to reduce air pollution have to be, quite messy, and quite incremental more often than not. Given all that, defining it in terms of a right to clean air, or a right to life, right to better health, is potentially useful framing sort of rhetorically, but it's not obvious how it necessarily leads to improved governance.
Great, thank you. Would you be happy to tell us a little bit about how you got onto this particular path and how you how your work has developed in this, and any advice you might have on people wanting to do something similar.
Sure. So, I mean, I think starting from an advice standpoint, right? So, none of this was planned. So, I did my PhD sort of focusing on the question of rural energy access in India, specifically sort of rural electricity access. I assumed that much of my career is going to be on the question of electricity distribution, on pricing, and things like that. But as it turned out, basically immediately after my PhD, during my postdoc, I worked on a project which basically was about setting up this pilot emissions trading scheme for industrial emissions in an industrial city in Western India, in a city called Surat. Yeah, I mean, that was, again, it was sort of an audacious project. I joined that primarily to sort of get some experience working with economists, working on air pollution, and at the time I had sort of not really worked a day of my life. I had joined grad school immediately after my undergrad, and I was very conscious that, look, if I want to build a career in public policy, one has to have worked with government in some manner. And this was an opportunity to do that, because this was a project done in very close sort of partnership with government agencies. And so from there, it was sort of, this was like clearly an important problem. It was clearly a neglected problem. Yeah, I mean, sort of drew me in. This was almost 10 years back. And so subsequently, I continued working on air pollution from different lenses. First with, at this group called the Energy Policy Institute at University of Chicago, working primarily with sort of development econ academics. At some point, it felt like that particular lens was sort of restrictive. It seemed like there were lots of interesting policy questions that we weren't even taking a stab at. So I shifted and I worked with folks who are coming at it from a political economy and environmental law lens to try and understand governance institutions better. What does reform look like? So that's what I was doing. And I was quite happy in that role when this particular opportunity came along, which sort of gives me a chance to zoom out even further and sort of be open to there being very different theories of change, some sort of more technocratic, some much less so, some that sort of privilege certain types of sources, sort of treating air pollution primarily as a vehicular problem or an agricultural residue burning problem, and the truths to all of that to some extent. And that's basically what has got me into this path and in this current role.
Great, thank you for that. I know you've got another section that you might want to add on. We've got a few minutes for that if you're interested.
Sure. I mean, I could. I thought I could give a flavor of cost effectiveness calculations when it comes to air pollution interventions, and sort of give a flavor of how we make grants, how we think about uncertainties, and so forth. I could jump into that for a few minutes, right? So, for example, I talked about how a bunch of our grants sort of focuses on governance support, right? Which is basically organizations that work closely with government to help improve implementation and so on. So, consider, and actually this sort of mimics an actual grant that we've made. There's an organization that wants to work with the state government of Punjab to reduce agricultural residue burning in the months of October and November. If you're sort of familiar with sort of news from India about air pollution, this is basically when air pollution levels sort of hit apocalyptic levels, right? So where visibility becomes very poor, where it becomes really hard to breathe. Air pollution in many ways becomes visceral in ways that it usually isn't, right? So what this particular organization would do is basically improve project management for the interventions that the government wants to do anyway, but where historically there have been significant gaps in implementation, right? And they ask for a funding of, let's say, $1 million over 2 years, primarily to support staff. So when we're considering a proposal like this, right, the way we would sort of approach grant making is sort of look at, all right, so what's the potential plausible impact that this could have in terms of averting the loss of healthy life years. So you would factor in the health impacts of stubble burning, right? Take it from me for now that that's at the level of 1 million DALIs a year. The extent to which that this is from this particular state, right, this particular geography, to what extent it is mitigatable by the types of interventions that the government wants to do. Further, to what extent would some of these gains not be realized without the process fixes that this particular potential grantee wants to implement, and the value of DALI averted, right? So that's a standard, that the $100K per DALI is a standard OP assumption. Some of these other numbers, there is some evidence to back it up.
Sorry to interrupt, Santosh. I'm not sure the audience can see your slides at the moment.
Okay. How about now?
Yes, they've appeared now. There we go. Great.
Okay. All right, no worries. Now, some of these are truly made up numbers, right? Because these are highly uncertain. The extent to which these are mitigatable by state government interventions, honestly, we don't know. This is one of those areas where there just hasn't been enough of a body of work, right? The claims made by this particular organization in terms of how much they'd be able to sort of make improvements, it's untested. We have no idea. Even after they have worked for a few years, it's likely that we would not have a very good sense of it. But still, we need to make a decision on whether or not to make that grant. So we consider to what extent. We also need to factor in to what extent they are sort of speeding up this work compared to the counterfactual. We assume that most things get better over the course of time. But what we are basically trying to capture is the extent to which improvements get sort of sped up, get pushed closer to the present by a particular organization, a particular project or whatever, right? So we multiply all these numbers, we get expected benefits of, let's say, $1.8 billion. The ask was for $1 million. The ROI is like 1800x, which used to be over the open fill bar, which makes this potentially good grant. At the moment, this would be a marginal grant, right? But I guess what I wanted to spend a couple of minutes on is just sort of a list of uncertain inputs that one has to sort of factor in here, right? Because many of these numbers, that just isn't, it's not like a settled fact, right? So how much does stubble burning contribute, right? This is something that we have a relatively good handle on. There are uncertainties, but for the most part, we're okay. What's the impact of this pollution on health or DALIs? Again, reasonable. There is, in general, when it comes to the health impacts of air pollution, there are some persistent uncertainties, but at this point, we have a reasonable handle on sort of how to handle those, right? How to factor in those. How much of the emissions can be reduced by the interventions considered is a completely unknown thing. That we would have to factor in. We do sensitivity analyses, try and make an educated guess, and try and see how, as we vary this input from a reasonable lower bound to a best guess estimate to an upper bound, how much would that sort of change our estimates? What chance of success does this particular organization have? The only way to find out is by actually giving it a shot. Any of the cost effectiveness calculations that we would do as grant makers involves a considerable degree of uncertainty. One has to exercise a significant amount of judgment on the inputs used, on the potential sort of distributions they fall into. Be willing to be extremely wrong, as I will almost certainly be with a variety of different grants I've made. But that's okay. That's sort of part of the job, part of the sort of learning experience, and potentially makes the future grants better. So I'll pause there. We have just, I think, 30-40 seconds left, so I'll stop.
Great.
Okay.
I don't know if I'm back. There we go.
Yeah.
Great. Thank you so much for that talk, Santosh. Thank you for coming along and providing this today. Good luck with the rest of your work, and thank you for everything so far. Have a great rest of your day.
Thank you.
Next.